I had to have these special letters, even though I couldn't pass the DMV eye test. My doctor said I was okay, but then after a while, this didn't work any longer either. So I actually had to go to the DMV and turn in my driver's license, which was like giving up your freedom. It was very traumatic for me to do that.
Yes, I tried to convince my mother to stop driving. At the time, she was in her mid-80s, and it was a very difficult decision for her, and it was a difficult time for me and my siblings, trying to convince her to stop using a vehicle that she actually liked a lot, and one that had taken her to so many places.
Well, in the case of my dad, he had Parkinson's disease, and in the beginning, the symptoms weren't that troubling or extensive that we were worried about his driving. But as the disease progressed, his ability to be aware of make short-term decisions did seem affected. We were very worried. I want to say that I think driving is, especially for men, a huge part of their identity. So I have a ton of compassion for anyone who's older who is being asked to give up something that's really a part of their identity and, most importantly, their freedom.
Hello, and welcome to Not Born Yesterday, a podcast dedicated to older adults and the challenges and joys of aging. I'm Miriam Goodman. Not Born Yesterday examines the problems and solutions of growing older today. We bring you the wisdom and voices of experts in the field of aging and offer tips on how to feel your best, use your lifetime skills and experience, and make the coming months and years as fulfilling as possible.
I'm Lynn Winter-Gross. Not Born Yesterday is brought to you by Next Village SF, a local nonprofit providing older adults with support to help age in place.
Today on Not Born Yesterday, we're talking about one of the most important aspects of aging in place, independence. Losing control over something that represents freedom and being in charge can be devastating and anxiety-producing. One of the major signs of independence for many older adults is their ability to drive. We began driving at 16, and here we are at 60 or 70 or more, and are understandably reluctant to give that up. We often think of it as a right rather than a responsibility. Also, driving ability doesn't decline overnight, and the gradual change may be difficult to assess. Yet talking about topics related to aging can be challenging. According to a survey of boomers, adult children would rather talk to their aging parents about funeral plans than driving concerns. So how do we know if our parent, spouse, or friend is no longer safe behind the wheel? And how do we start the conversation?
Our guest today is Melanie Henry, founder and CEO of the Driver Cognitive Assessment Center and author of a chapter in the book, Difficult Aging in Place Conversations. Melanie knows how difficult it is to have a conversation that deals with a person's sense of independence. She often lectures on the issues of driver assessment, treating the serious subject in an understanding way while stressing the need to start the conversation. So let's begin. Melanie, welcome to Not Born Yesterday.
Thank you. It's great to be here.
Driving is a complex task. It requires attention, judgment, and memory to be successful. And many of us are reluctant to bring up this topic with our family members. If we think our loved one needs to stop driving, where do we begin? Do we say we're concerned, or will this make them defensive? Do we say we don't want their grandchild in the car with them if they're driving? Is the adult child the right one to have this conversation? And how should the conversations take place?
What I suggest to the families that call me when they are concerned about their aging parent is I always ask, when was the last time you got in the car with your mum or dad and went out on the road? And it's really quite shocking to me how few are actually doing that, especially if they live out of town. And so I try to encourage everyone, try and make it a normal part of your time together when you visit your parent. Go with them to their regular places and see how they're doing. don't make any comments while you're in the vehicle with them, but just start to observe. And there's a long list of warning signs, and I encourage everyone to make some notes about that. What they see, what are they seeing that's starting to change? Are they seeing, a concern about their driving happening a number of times each time they visit with them? That's kind of the first place to begin, as well as making sure that the spouse or, their parent has had a vision exam, because 90% of what we're processing behind the wheel is through our eyes. So having good vision is really critical. That and doing the ride along, the first couple of things that I ask people to do.
Hearing, I assume, is also a problem?
Yes, hearing is a problem, can be a problem, as well as arthritis that can develop. If we've all had injuries when we were younger, tends to show up as arthritis when we are older drivers. But there are lots of driving aids that can help with that. There are things called a seatbelt puller that can help, extend that seatbelt across the body. But it's all part of that assessment. I think that staying in good shape as much as you can and being as active as you can. I mean, I have some clients who really struggle to get in and out of the vehicle, but there are devices like a wheel, it's like a swivel cushion that helps keep the legs together, and it spins like a lazy Susan for your butt.
You've told me before that many people who give up driving become depressed and isolated. And that seems almost to be the most important takeaway from whatever the conversation will be. So could you explain a little bit about that depression and isolation?
Yes, it's tied in with how heavy we rely on transportation here in the US. Our communities are not really set up with public transportation particularly well. You live out in the cities, the suburbs, but you're in a really big city. And so what happens is when you have lost, that sense of independence by no longer having the car keys, there's been quite a bit of research out that says that those next 6 months are really critical in terms of preventing depression, because that person, their whole social system, for some, grinds to a halt. And so it's really important to have a support system in place and make sure that you've had those conversations with the family, with neighbours, with friends, like what is the plan to help this person still continue to live as independently as possible. And most people that work in this field, they're acutely aware of that and will do their damnedest to try and get those people connected with all of the transportation in their communities. And I'm happy to help anybody from anywhere in the US who's facing a transition and they don't know who to call. A lot of the senior centres will have volunteer driver programs. There's also programs at local and state and federal level that many people are qualified for and don't know about. So it's really just getting really savvy about what are the resources out there and how can I help my loved one tap into that.
And it's hard for us to call our friends or the local senior center saying, I need a ride for a half a mile away.
Yes. And people feel like they're a burden when in fact, if you're relying on the same person, I can understand how you would be feeling like that. But if you can spread that care and that responsibility, usually, it settles into a nice, easy pattern. And there are lots of volunteer driver programs where they don't want to do those longer rides. But the reality is if we have somebody with cognitive impairment, whether they're driving 1 mile or whether they're driving 10 miles, they're still at the same level of risk. So it's really important for those older drivers, if there are some cognition concerns, that the family and friends and that support system work really closely to get them connected with the rides so that they can continue to live fully as possible.
I've always wondered why doctors don't bring this up unless some do in physical exams of older people. Why don't they say, are you driving? I don't know if you should be driving. And I have a friend, I called their doctor and I said, this person shouldn't be driving. And the doctor said, there's nothing I can do about it unless I get in the car with this person and drive around. There's nothing I can do about it.
Lynn, that's a good point that you make. It really depends on what state that the person lives in. I'm based in California, and the doctors here are mandated where there is someone has a fainting episode, or where there are clear cognition concerns, but a lot of them don't report. And I think part of the reasoning for that is that their patients are not having those conversations with their physician. They're worried about bringing this up because they're worried about their licenses being revoked. But also the doctors, their exams are down to like less than 15 minutes. It's not a whole lot of time to cover this. And driving is such a multitasking activity. It's a really specialized evaluation, and they just don't have those resources. And currently, Medicare doesn't cover driving assessment because it's not considered a medical necessity.
My mother-in-law was driving on California freeways at 94, and she never showed any signs of unsafe driving. And of course, the Department of Motor Vehicles thought she was a safe driver, I guess, because she passed all the tests and they let her renew her license. But should we question her about these things just because of her chronological age?
There's a fine line there too, right? Because you don't want to be seen as being an ageist. I think that what we do know from the research here, Miriam, is that drivers that are 85 years plus, their driver per mile risk is the same as someone that's 15 to 24 years of age. And it's not because they're getting into more collisions, it's because the frailty of the human body as we age, they're more susceptible when they do have a fender bender to likely sustain more injuries than somebody that was, 30-year-old that walks away from that collision. And so particularly around chest complications. So I think if you have someone in your family that's 75 years plus, there's certainly the risk starts to elevate at that point as well, but it really escalates at the age of 85 plus. I think that it's good to have a driving evaluation because it gives the driver and their family or whoever's in their support system a baseline, like where are things currently at? Because typically driving skills, like you said earlier, they don't change overnight unless there's something medically going on. Those changes creep up, and we have a lot of people in this country that are driving, that are living with dementia and are still driving. The Alzheimer's Association estimates that 30 to 40% are driving, and of that, we don't know where they are in the stage of the disease, but we're talking somewhere between 2 million to 2.7 million people that are driving with dementia that may be diagnosed or undiagnosed, may not have had a conversation with their families. They may be compensating and trying to hide, some of the changes that are going on, or they may not be aware. And then how many of those are not even talking with their physicians?
One of the things that I think is hard, how do we judge our own driving? What signs should we look for in our own driving to know if it's still safe for us to drive?
Yeah, good question, Lynn. And I think that's where having an understanding of what the warning signs are, and you can go out with a friend, family member, somebody that you trust, somebody that you feel will be honest with you, and have them be an observer with you and go to all of your regular routes, but also go on an alternate route. What did they notice? What you want to be looking at is how are you emotionally feeling when you get behind the wheel? Are you feeling really anxious? Are you have some trepidation about getting back behind the wheel? Have you just recently been admitted to hospital or to an assisted living facility or had an injury or surgery? Has there been some kind of event like that in your life? And maybe you haven't driven for a few months. I have some clients where they haven't driven for 3 to 6 months because they've been rehabbing, and their confidence is really at an all-time low, and they're worried about how they're going to do back out on the road.
So, Melanie, you say there's some tips if we're worried about ourselves. Could you share some of those with us?
Sure. So one of the ones that a lot of people don't think about is if you've been out on the road going to your regular routes and you come back and you notice that you were being honked at by a lot of other drivers, there's usually, that could be a bit of a red flag that there's something going on about your driving skills that are concerning to other drivers that maybe you need to kind of pay attention to. If you start to notice that you're finding it really difficult when you go to make a left-hand turn and you're having trouble judging the distance of the vehicle coming towards you, because depth perception can change as we age. If you find that when you get to the supermarket, you've forgotten the purpose of why you're there, you're getting a little bit disoriented. If you notice that maybe, and I know people laugh about this on social media when they see someone parking incorrectly in their parking spot space, but if you're doing that a number of times, the thing here is that, is it happening more than once? We say there's research out that says if it's happening, 5 or more times, is there a pattern to it? Is it increasing in severity? The other big one is, are you seeing on your vehicle lots of scrapes and dents on your car and you can't remember what happened? If you're seeing damage to your mailbox or the garage door. The other one too is, are you noticing in your social circle that when you when you offer to drive and nobody wants to ride with you, if there are a lot of excuses being made, oh, I've got you covered, I'll drive, you drove last time. If you're finding that that's happening more than 2 or 3 times, that could be because your friends are not feeling safe being in the vehicle with you. I did talk earlier about a recent admission to hospital skilled nursing facility. But the other important one is if you've had 2 or more falls in the last 12 months, there's a correlation between that and increased driving risk.
Well, I always laugh and say we're lucky to be in a time where there are alternatives to driving, because Lyft and Uber and other rideshare programs came around just when the boomers were starting to need them. And they're great if you live in a city that has them. So you mentioned before, people who live in small towns or suburbs may not have those options. So what does somebody like that do? Do you think you go to your city council? Do you ask for legislation? Do you try to expand any of the volunteer driving? What would you suggest for someone who's living in a place where there isn't much in terms of ride sharing or taxis?
Yes, I think, yes, we've all got to lobby more about this important issue. Usually there's a volunteer driver program made up with other drivers in the community that will help get those people around town. But quite often there are paratransit programs. Some of them are a ride share service. Some of them are, offer like a taxi rebate. It really depends on where you live.
One of the things that I see a lot when I talk to people about giving up driving or selling their cars, well, oh, no, I'm not going to spend money on Uber and Lyft and all this stuff. I say, wait a minute, you're spending money on your car insurance and your car repairs and maintenance and gas, but they don't see it that way.
I think, yeah, certainly doing a cost analysis versus then, writing out as well, where are all their usual destinations and figuring out the costs of that as well. What tends to happen is when families present this to their loved one and they try it out, what I suggest is go with them on those first couple of rides, because, it's another change and it's the fear of the unknown. So go get into the Uber or Lyft or the rideshare service that you're doing. But if you've got someone in your life and they're a little anxious about making that switch over and starting to, have a plan B, because it's always better than doing it when you're in a crisis. Go for that ride with them and just kind of help them navigate through that. And then what I usually see is that after a couple of months, that driver is really happy to be a passenger. It takes a whole lot of stress off the person. And then before they know it, that's just part and parcel of their daily living.
So, one of the things I read recently is it's a good idea to sit down with your parent or friend who is ever giving up the driving and show them how to do Uber or Lyft or whatever is available in their community. And that gives them a sense of power because then they can do it themselves and feel that they're in charge.
Absolutely. You've got to involve your parent or your spouse, whoever is the person that's transitioning away from being behind the wheel. You need to have them actively involved in this because they need to feel that sense of empowerment and that they are involved in those decisions. You'll get a lot further.
Well, I think that's the best advice that you could give. So thank you so much for all this important advice. And I know our listeners, I hope, will feel more confident if they have to have that difficult conversation. Our guest was Melanie Henry of the Driver Cognitive Assessment Center.
Thank you so much for the opportunity.
Today on News You Could Use, we're sharing some exciting information that will make the readers among us happy. A Yale University study found that people who read books live longer than those who don't. The researchers asked more than 3,000 participants over the age of 50 about their reading habits. They split the people into 3 groups: non-readers, people who read less than 3.5 hours per week, and people who read more than that. They followed each group for 12 years and found that all readers live longer than non-readers, regardless of gender, wealth, education, or health. And those who read more than 3.5 hours a week live 2 years longer than people who don't read at all.
The study analyzed what people were reading and concluded that what you read makes a difference. In comparing people who were reading fiction to those reading periodicals, the fiction readers had a better outcome. Why? Because they get more immersed in their reading and create an emotional connection with the characters. This is an advantage that newspaper and magazine readers generally don't have. There are a few theories about this. First, books encourage what they deemed deep reading. Rather than just skimming over a headline and the bite-sized information in an article or social media post, reading a book forces you to make connections between chapters and the outside world. When you make those links, you forge new connections in your brain. One of the best ways to stave off dementia and other cognitive decay. According to the scholar leading the project, brain scans showed significant increases in blood flow during reading. This, she suggests, shows that paying attention to literary texts requires the coordination of multiple complex cognitive functions. So no matter how we choose to read, either hardbound, paperback, or ebooks, the study concluded there are no real downsides to reading other than making the time for it. So next time you pick up a book, remember you may be adding years to your life.
And that's our podcast for today. Our thanks to our guest, Melanie Henry of the Driver Cognitive Assessment Center. You can learn more about Next Village SF at their website, nextvillagesf.org. Our theme music is from Hook Sounds, and Jason Dahlstad is our engineer. And thank you for listening. We'd love to hear what you would like us to discover and discuss. Please contact us at notbornyesterdaypodcast.org. Follow us on Facebook and Instagram, and subscribe wherever you listen to podcasts. All of these are free, and let us know our audience better. Be well, stay strong, and remember, you weren't born yesterday. I'm Lynn Winter Gross.
And I'm Miriam Goodman.